So this week's topic is about Hashimoto's. And here's the thing. You might have Hashimoto's and not even know it because you're getting the wrong tests. And if you already have it, you might not be treating it correctly if you don't fully understand what it is. The classic symptoms for Hashimoto's are fatigue, weight gain, joint pain, muscle pain, constipation, inability to get warm, difficulty getting pregnant, hair loss or thinning, irregular heavy periods, depression. These are common symptoms for a lot of diagnoses. So how do you know if these symptoms mean that you have Hashimoto's? And as I said, if you already have Hashimoto's, how do you know that you're getting the right treatment? So today we're talking about Hashimoto's thyroiditis, also called Hashimoto's disease, also just called autoimmune hypothyroid, what it is, how to know if you have it, and what you can do about it. And the first thing we have to talk about is, what is the thyroid and what does it do? Because if we don't understand that, we're not going to really understand how to test for it and how to treat it. So here's the classic scenario many of you are going to experience or have experienced. You're going to go to your doctor or NP or PA. You're going to have these, maybe you have these symptoms, fatigue, weight gain, brain fog. Maybe you have a family history of hypothyroid. So you go to your doc, your PA, your NP, and they run a test called TSH. And if that's normal, then you're advised that you don't have a thyroid issue and all is well with the world. But is it? Now, in order to find out if this is enough, the TSH is enough, we're going to have to get a little technical. I'm going to have to tell you what the thyroid is, what it does. But if there's one thing I know about my listeners and about my game changers is you can handle it. I love you guys so much. You allow me to get technical because you actually want to hear it. So here we go. The thyroid gland is located in the front of your neck right here, and it makes hormones that controls your metabolism, which means it affects your heart rate, how quickly your body uses calories you eat. The thyroid releases two hormones, T4 and some T3. And these two hormones affect, as I said, your body temperature, your heart rate, and use up the calories from your food. Sometimes your body needs more, sometimes your body needs less. And to know how much hormones to make, the brain has to get involved. So inside the brain, we have a gland called the pituitary gland. And when it senses that it needs more fuel, it tells the thyroid, hey, buddy, it's time to wake up. I need to burn more fuel. Please release some more T4 and T3. And so the thyroid, the normal thyroid that has no problem, complies and sends out some T4 and T3. By the way the brain speaks to the thyroid is through a hormone called TSH, thyroid stimulating hormone. Sound familiar? Yes, because that's a test that we just talked about. So the brain realizes, hey, we need more fuel. The pituitary gland releases TSH, thyroid stimulating hormone, to stimulate the thyroid and says, wake up, do your job, and give us some more T4 and T3 so we can increase our metabolism. The thyroid releases T4 and T3, and that tells the brain, hey, we got the message. Look, we're producing the T4 that you asked for. Everything is good. So it's a nice friendly communication between your brain and your thyroid. The brain talks to the thyroid with TSH. The thyroid talks back by saying, I got the memo, and releases T4 and some T3. And the brain is like, cool, everything is great. And round it goes, and all the levels are normal. So far, so good. But hypothyroid is what happens when the thyroid gets the message. The brain says, hey, dude, wake up. So it gets the message to produce the hormones, but it can't deliver the goods. So the brain sends the TSH, and the thyroid can't produce T3 and T4 for some reason, which we'll get to in a moment. So the brain does not like to be ignored. So it keeps sending the message to the inbox over and over again. More TSH, wake up thyroid, wake up thyroid. And the inbox just keeps getting full of TSH, just messages, TSH. And the thyroid cannot produce enough T4, so it doesn't calm the brain down, and the TSH just keeps filling up the inbox. So notice, when the thyroid cannot produce hormones, it's underactive, hypothyroid. And in that case, the TSH numbers go up. The inbox is full. This is something I want you to grasp because a lot of people have a hard time. Why is my TSH going up and my thyroid is underactive? This is why. It's just your brain keeps telling your thyroid to wake up and do its job, and the thyroid can't. So the TSH builds up. Okay, so now let's go back to that doctor and PPA you went to before with those symptoms. So, and they say, and you say, I think I have an underactive thyroid. Again, they'll check that TSH, brain talking to the thyroid. If it's normal, everything is normal. If it's high, the doc or the PA will say, oh, your thyroid is underactive. It's not producing enough T4. Great, I have the solution for you. Here is T4 in the form of a pill, which is Synthroid or levothyroxine. You take the T4, Synthroid or levothyroxine, the brain gets the message that now there's enough T4, and the TSH calms down, and all is right with the world again because the loop is fixed. And that's how you know if you're taking enough of the medication. Once the TSH normalizes, the inbox is not full anymore, TSH is normal, and that's how you know you're getting the right dose of T4. And this is how hypothyroid is tested and treated in conventional medicine. It's a loop. TSH is good, loop is okay. TSH is high, that means the body can't produce enough T4, and we give you T4. This is not wrong. It's necessary. And you certainly need meds. If your TSH is high and your body's not producing, there is no question that you're going to need these medications. It can become life-threatening. So I want to be clear that in no way is this talk about not taking your meds. You must take your meds. But it's not the whole picture because it doesn't deal with the why. Why did my thyroid suddenly stop producing T4 and then T3? Why? Why did it happen? Right? It fixes the issue, fixes it in quotes. It gives you the T4, but it doesn't ask why it happened. By the way, for those of you listening, there's also a scenario when the body produces too much hormone. That's an overactive TSH, and that's called Graves' disease. It's not the topic of discussion here, but I had a few people reach out to me before this episode asking me to talk about it. So there are some common issues, some commonalities, and I will point them out in this episode, okay? This is for you guys. I told you I read every message. Okay, so back to hypothyroid. We're talking about thyroid not producing T4. Why is it happening? There are several reasons why it's not happening, but the most common is an autoimmune issue called Hashimoto's, which is what this whole talk is about. Autoimmune means the body is attacking itself. So if we have autoimmune thyroiditis, Hashimoto's, it means the body is attacking the thyroid. Now, if you were trying to do your job, whatever your job is, and all day long somebody was attacking you, you would not do your job very well. The same thing is true for the thyroid. The body keeps attacking it, and it's like, okay, I'm having a hard time producing T4 because someone needs to slow down this attack. So you might say, okay, I got it. It's an autoimmune issue. Who cares? I still need my meds. It's underactive. So like, why are you bothering me and letting me know it's an autoimmune issue if I still need my medication? Because when you have an autoimmune issue, it's not about just the thyroid. It's about the entire system. Just like my patients who have psoriasis, it's not just a skin issue. Yes, they need cream, but what's causing it is really important because it's a system issue. My patients who have rheumatoid arthritis, yes, their joints hurt. Yes, they might need medication, but it's a system issue. And it's just a flare-up that's expressing itself in your thyroid or in a particular organ, joint, skin, whatever. But it's not enough to just manage this little part of the system. You have to address the entire system. And that's true for high and for low, for those listening who have Graves. So before we go on to explain how to address the system so that it's calm and in effect calm the thyroid, let me keep talking to you one more minute about testing, because we're not done about testing, because I told you they just had to test the TSH. So before I talk about addressing it, let's do a little bit of a drill down here, because you're going to want to know this. For those of you who think you might have it and you're not really sure and you keep being told your TSH is fine, you're going to have to ask for more tests. You now understand that I talked to you about T3, T4, antibodies. You should start getting a sense that there's no way that TSH is enough information. Okay. So again, if it's normal, great. But what if you're cooking a thyroid issue? What if your thyroid was under attack for years, but your TSH is fine? What if it's a really strong thyroid and it's trucking along and it's producing T4, but this whole time it's under attack? Like, we have that understanding with diabetes, right? We have diabetes, and then we have this whole world of pre-diabetes where we can tell the patient, hey, sir, ma'am, you're on the verge of getting diabetes. You might want to cut back on the cheesecake a little bit so you don't get diabetes. Wouldn't it be cool if there was a pre-thyroid test? There is, obviously, or else I wouldn't talk to you about it. That's the antibodies that I was just talking to you about. The antibodies, the body attacking itself, right? When the body attacks itself, it creates antibodies, okay? And you're not supposed to have antibodies to your own thyroid. You're supposed to have antibodies to COVID, antibodies to measles. You're not supposed to have antibodies to your own thyroid. So you can have a positive antibody test for years, for decades, before your TSH shifts. But in conventional medicine, we don't test for those antibodies unless there's already a problem. And in my practice, we test for antibodies first, or in addition to the TSH, to let people know, hey, you're in that pre-thyroid stage, you might want to get on it. So again, imagine if instead of just testing for TSH, we also tested for antibodies. And now we know, hey, I have antibodies. I know my thyroid's under attack. And now because all of you now listening are functional medicine gurus, you know that if it's under attack and there's an autoimmune issue, we know it's a system issue. And we know that there's probably some things that we can do to help calm this down. In conventional medicine, there is nothing to do with a positive antibody test. So I just want to let you know, if your provider told you your TSH is fine, but you have antibodies, don't be frustrated when you say what's next, and they're going to say nothing. We just have to wait for your TSH to shift. They're not wrong in that world, because in that world, they can only medicate when the TSH is off. Okay. But in functional medicine, we're going to say, autoimmune cooking, let's start intervening. So hopefully it's clear by now that TSH alone is not enough. You have to ask for antibody testing. And one more tidbit about testing, since I'm talking about, we said TSH, we said antibody testing, but we also need T4 and T3 testing. And that's because thyroid makes mostly T4, and T4's job is to convert into T3. T3 is the active form. So again, if I'm producing enough T4 and I'm telling my brain everything is fine and my TSH is going to be fine, but what's happening? What about if my T4 is not converting into T3 enough? We have that. They're under converters. Their T4 is fine, their TSH is fine, but the actual thing that they need, which is T3, is low. So this will never be picked up if the only test you do is TSH. So you really want a full thyroid panel, TSH, and a full count of how many T4s you got rolling around, and a full count of how many T3s you got rolling around, because if they're low, you might actually not need just T3 replacement, okay? So you have to get the whole thyroid panel, not just TSH. Okay, I think you got it now. You're understanding. This is what's really important to take away from that. One is that thyroid issues, high and low, can be an autoimmune issues, and you have to address it as an autoimmune issue. And two, that you need to test. When you ask for a test, TSH is not enough. Now, let me be clear about this. And I want to say it again. I'm going to say it several more times. If your TSH is high and you are prescribed medication, never stop taking it. I'm not telling you that you can manage this without. If it's already damaged and you already need medication, you're probably going to need it forever. And without it, this can become deadly. This is not the game to play. No one in functional medicine would ever tell you to stop taking your medications. If they tell you to stop taking your medications for thyroid, it's a bit of a red flag. So on the topic of medications, though, make sure you're working with a great endocrinologist or functional medicine provider who understands that thyroid is not just T4. By testing, sometimes they also have to give you T3. Some people get a combo of T4, T3. Some people need just T3, and some people need just T4. So make sure that you're dealing with someone who knows how to prescribe the right medication. All right, so we're done with meds. So now we have to talk about the fact that Hashimoto's is affecting the entire system, not just this little guy in the front, not this little butterfly-shaped gland in the front. Something is happening to your entire system that is causing havoc here. So the question that must be asked is, what's happening in the rest of the body? And in functional medicine, we don't just look at the one thing. We look at all the triggers. And there's a lot, because there's a lot of things that can cause inflammation, and inflammation causes autoimmunity. Again, little note for my Graves patients, this is where it's at for you. Figure out what is inflammation, what's causing the autoimmunity, in addition to, of course, seeing your endocrinologist. So let's talk about what it could be. For some reason, for some people, it's not necessarily a bad trigger. For some women, it's actually their pregnancy that triggers it. Something happens with the hormones of the pregnancy that will trigger an autoimmune response. And they will say, ever since the birth of my child, or ever since my pregnancy, my thyroid has been high, low. Okay, so sometimes it can be that, because it really pushes some people over the edge. For others, it's environment, things you're exposed to, mercury, toxins. We're exposed to so many chemicals that interfere with thyroid function. These are chemicals that are called autogens, meaning they cause autoimmune disease that we can be exposed to. It could be a reactivated virus. It could be stress related. Stress has a huge impact. So you might have the genetic predisposition for it. Mom has it, grandma has it. And then all of a sudden, a stressful event will happen, and suddenly your numbers are off. So anything can kind of set the cascade going. But one of the most common triggers of Hashimoto's and autoimmune issues is nutrition. And for Hashimoto's, it is specifically gluten. Now, gluten is everywhere, but the connection between Hashimoto's and gluten is really linear. There's so many studies on it. And like a basic info is, you eat the gluten and it creates a leaky gut. I did a whole episode on leaky gut. Find it. We're not going to go too into detail here, but you have this leaky gut, which causes inflammation. And so now you have this inflammation forever, which eventually causes the autoimmunity. I cannot tell you how many of my patients will come in for their thyroid and have been suffering with gut issues for the past 5-10 years. They sometimes don't even come for the gut issues because they're so used to their bellies being angry all the time. They're coming for the thyroid, and they don't understand that it's connected. Because once you have a leaky gut, you're going to start making antibodies to gluten. And those antibodies to gluten, through something called molecular mimicry, are also going to create antibodies to your thyroid. So a super oversimplified version of this is basically every time you're eating a sandwich, you're attacking your gluten. Well, unless it's a gluten-free sandwich. So that's the simplified version of it. So if you have Hashimoto's, one of the things to consider is to go gluten-free. Calm down the inflammation, calm down the leaky gut, and calm down the thyroid. And many of my patients who have Hashis will also have genes that makes them predisposed to gluten sensitivity. So see if you can get tested for that. Okay, they're called the HLA genes. See if you can get tested for that, because it shows a predispositions to gluten sensitivity and celiac disease. And many of my patients have them. So remember that the cause of your Hashimoto's, your autoimmune issue, is inflammation. These antibodies, it's a system issue. It's not just a thyroid issue. And this inflammation, if you don't address it, can also attack other body parts, your skins, your joints. So until you fix this issue, you're actually not fixing the autoimmune issue, and you're going to have more and more organs involved. So remember, it's not just about taking the medication, which is important, but it's finding the root cause. What triggered all of this? So you don't just want to say, okay, great, I've my meds, I'm set. Always try to find out what's causing it. How do we control the antibodies? And if we catch it early enough, we may be able to reverse it so it doesn't become full-blown Hashimoto's. But if we can't reverse it, we can stop it from getting worse. And again, this thought process is also there for my Graves patients. Make sure you see your doc. There's no question that you need conventional medicine here, but also try to find the root cause of why this autoimmunity got triggered. So now let's talk a little bit about supplements, because there are some supplements that are critical for thyroid function. The first thing people think about with supplements for thyroid is iodine. And while iodine is certainly needed for thyroid function, there is some controversy about how much. So don't run out and take more iodine just because you heard it's connected to thyroid. In fact, studies have shown that excessive iodine intake has been found to trigger the autoimmunity. Okay, it actually triggers Hashimoto's in some people. So you don't want any more than 750 micrograms of iodine a day. That includes what you eat. So that doesn't mean go run out and take 750 micrograms of iodine on a pill. Take a look what you're eating, because it's in your salt, it's in foods with seaweed, it's in oysters. There's a lot of foods that have iodine in it. And if you're already getting to 750 micrograms, you do not need more supplementation of iodine. So please watch for that. I've seen people kind of cause themselves damage because they're taking too much because they just think more is more. So the first thing you want to do, as we said, is calm down inflammation. Gluten-free diet, consider dairy-free diet, and then supplements for inflammation. Omega-3 fatty acids, these are general, not necessarily thyroid specific. NAC or glutathione, calm down the inflammation, get the system ready. And then the supplements that are very specific to thyroid are vitamin D, that actually helps with the gene transcription part of thyroid function. Selenium converts T4 to T3, so we need that. And zinc is also crucial for proper thyroid hormone metabolism. So those three are some key players for you if you're having hypothyroid issues. And remember, it doesn't have to be in supplements. It could be in your foods, and we want it to be in your foods. So selenium is found in fish and Brazil nuts. Zinc is found in pumpkin seeds and oysters. You have omega-3 fats, which are in fatty fish. So always try to get it into your food. You want to eat as much of the rainbow as possible, and then add the supplements. By the way, real quick, there are some foods called goitrogens, which actually block the thyroid function, which is like raw kale and bok choy. They're okay in moderation, eat the rainbow, but I don't want you making like 3 or 4 bok choy or raw kale salads or smoothies thinking more is more, because in fact, it could take you backwards. So as long as you eat a normal amount and you're not like eating 2 bags of them, trust me, I've had people who eat 2 bags of kale a day. Don't overdo it because they can actually cause some harm. So, quick recap. Hashimoto's is not just a thyroid issue. It's a system issue. It's an autoimmune issue. It's affecting your whole body. It's just expressing itself in your thyroid. Make sure you get the right tests, the entire panel. I hope after listening to this, you recognize that TSH is not enough. Make sure you're getting the right medications. Sometimes Synthroid is not enough. You might need T4, T3, or just T3. Make sure you find the root cause, remembering that it's an autoimmune issue and something is triggering it. Change your diet and take supplements. And of course, if you want to work with us, because there is a lot of information here, you can find us at The New Method on every platform except for Twitter, because I talk too much, or thenewmethod.com. Shoot us a message anywhere you are, because we will answer. And we look forward to working with you, because you always knew there was a better way. I'll talk to you guys soon. See you next week.